detail because Nicola just did. But these are the information streams that go into making the recommendations for the seasonal vaccine strains. We use essentially the same process for these zoonotic strains as well, with a little bit of difference. Clearly, we're talking about viruses that circulate within animals. So we bring in a lot of additional collaborators into these discussions, including the WHO H5 reference laboratories, including laboratories from the animal sector, particularly the OFFLU group, which is an FAO expert group of individuals on influenza who come to these deliberations as well. Typically, although there are also a little less data on some of these viruses than the seasonal counterparts. But the bottom line is the same type of process is used. We look at what viruses are out there, what their genetic makeup is, and what their antigenic makeup is. And so I'm going to run through, just as Dr. Lewis did, go through what we actually talked about last week. So here is just a slide showing the number of zoonotic cases. Again, these are viruses that have gone from animals into humans, but haven't gone any further than that. So each of these, a number of cases on this axis, the time across the bottom, each of the different colors represents a different virus that's circulating in the animal populations. There is a huge diversity of different influenza viruses circulating in some of these animal populations. It's only a small percentage of those that we actually see making this jump into humans, and they're represented by these different bars here. Sorry, it's covered up on my end. These are the different subtypes of viruses that we detected, of animal influenza viruses that we detected in humans in the past 6 months. And we'll talk about some of these now in a little bit more detail, particularly in the context of, do we need to update our arsenal of candidate vaccine viruses? So the big one that we spend most of our time discussing was the H5 viruses. And for reasons I think most of us are aware, these viruses have spread on a near global scale in the past couple of years. So this is a map from OFFLU. Each of these dots represents a detection or an outbreak in animal populations, so primarily in birds, the odd wild mammal as well. This sort of number and alphabet soup over here describes the genetic clades of viruses that were detected in this period. The big one has been this 2344B, and this viruses belonging to this particular genetic group are responsible for most of the dots that you see on this map. So it's really all of the dots in the Americas, most of the dots in Europe, and Africa. There's a little bit more diversity across parts of Southern and Southeast Asia. But again, these 2344B viruses have been the ones that have been causing most of the problems over the past couple of years. We look at actually what's spread to human. Again, the majority of these have been the 2344B viruses. A couple of these, a different clade in Cambodia in February of this year. All of these individuals, with the exception of one from Chile where it was unknown, are people that had very, very close exposure to infected poultry. So poultry to human infection or detection. These people, these 4 cases from the UK are a good example of that. These were individuals that actually involved in depopulating an infected poultry flock. It's still some uncertainty about whether they were actually truly infected or just because they were in an environment that was so heavily contaminated, it looked like they'd been infected. And so you can see the age range here, mostly in adults or heading towards the more elderly adults. And here's a total number of cumulative cases we've had since early 2000s with viruses from the H5 lineage. The good news from a candidate vaccine virus point of view, when we looked at these viruses circulating in animal populations, particularly those related with the human cases, we found that the candidate vaccine viruses that we've already produced still reacted very, very well with the current crop of H5 viruses. So we made no recommendations to update our list of CVVs for H5, despite the fact that there's still very, very widespread circulation of these viruses in animals, mostly birds, with very sporadic spillover into humans and other mammals. If we look at the other virus, this is perhaps the virus that H5 aside is the most often found subtype of influenza in poultry populations around the world, the H9N2 viruses. During this period, we saw a lot of activity of the H9N2s, again, in poultry populations in many regions of the world. In China, there were 5 reported human cases from these H9N2 viruses, again in poultry exposed people, so people with very, very close contact with infected birds. And as you can see here with the H9, and this is a trend we typically see, it tends to be the younger individuals that are infected with H9. You can see here the disease was always mild. Again, H9N2 typically causes more mild disease as a whole than H5 can. And so here's some of the actual data we looked at with these viruses. And again, remembering these are our current vaccine viruses, candidate vaccine viruses across the top. The numbers in bold here are the homologous titers of anti-serum raised to those. As you go down the list here, as you get smaller numbers at the bottom here, that means that these vaccine viruses don't react as well with the currently circulating viruses. And I've circled this group here because it's the group of H9N2 viruses that have been circulating in mainland China for a few years now, causing human infections both in 2022 and the 2023 viruses belong to this group as well. And you can see the hemagglutination inhibition titers to these viruses were lower than the homologous titers for each of the vaccine strains that we do have. Again, that's a signal to us that we need to go ahead and update viruses for this group, and we did. And so we recommended 1 new H9N2 viruses that represents the current crop of H9N2 viruses in China. This data shared by the WHO Collaborating Center in Beijing. So again, 1 new H9N2 candidate vaccine viruses. If we switch now to what's been going on in swine, so you have another very, very active zoonotic interface with humans. In the swine populations, it's a more limited number of subtypes of influenza circulating, H1s and H3s, so similar to the viruses we see in humans, at least in subtype. The viruses themselves are a little different. There was a number of cases detected in the last 6 months across a number of countries. There was 1 fatal infection in Brazil. This individual had some underlying conditions, though, that probably led to the severity of the disease most of the time, like H9N2. These infections are mild, and again, most of them having exposure to swine. In terms of candidate vaccine viruses, most of the viruses that were detected in humans here were similar to candidate vaccine viruses we already had. The one area we were a little less confident on was these H3N2. So in the US, these human infections happen at the agricultural state fairs where people come along and it's a competition to show off your best animal. There's prizes for the winner. And often in these environments where lots of people come through these swine barns at these agricultural fairs, sometimes the virus does spill into humans. And that's what happened here. Although we didn't have the virus from that particular human case, there were some viruses detected in these agricultural fairs around where that human case occurred. They belong to a couple of different genetic lineages here. So these numbers here refer to lineages of these swine viruses, and doing the same thing here. So looking at these numbers in bold here and looking at how much smaller these numbers are than those numbers, you can see that really this current group of H3N2 viruses here were poorly recognized by any of the candidate vaccine viruses that we have, or anti-serum to those candidate vaccine viruses. So we recommended a new H3N2 like CVV, again, to represent this group of viruses circulating in swine that we know have the capacity at least to transmit from animals to humans. So I'm going to stop there. So I think, just to summarize, the zoonotic candidate vaccine virus development is an integral part of the VCM meetings. We're getting more and more information collected from a range of collaborative partners, both within GISRIS, The RLs, the H5 reference labs are key players here, as is OFLU and additional partners, some academics, some other national partners that provide information and viruses to this as well. As discussed, the process is very similar to the one Nicola described for seasonal, just focused on a different set of viruses. The problem, of course, that we have in the animal realm is that there's such a huge diversity of viruses that are circulating in these animal populations. And that's where the challenge we have is we can't prepare against them all. So we've got to focus, do a more risk assessment approach to determining which CVVs we will develop. And as I said, 2 CVVs recommended past this past VCM. So a couple more to add to the list. Hopefully we won't need to use any of these, but just in case we do, they're there. And again, I think I've acknowledged to people through. So I will stop there and flick back to you, Wenjing.
Great, thank you, Richard, for the presentation. So we have about 15 minutes for Q&A. Before we start the Q&A, just to introduce the panelists. So the panelists, including the 2 speakers just spoke, and also my colleague, Dr. Aspen Hammond, who actually already typed quite some answers to some questions already, and me as well. So all of us jointly will be able to answer your questions. Look at the long list of questions in front of me. A group of the questions are related to the BEAM component. So the questions cover like why or how we make this decision to remove the BEAM. But just to clarify, for the upcoming Southern Hemisphere 2024 season, the quadrivalent vaccines, the vaccine composition are recommended, and to include actually the BEAM there, while the efforts are being made to remove this component in the vaccines. The questions cover why or how confident we are the recommendation was made, and what we are going to do with this one additional component, if not BEAM, what it could be, its implication to confidence, to trust on the vaccines, and how surveillance actually was conducted for BEAM. Maybe Nicola, would you want to start answering these, and others would be able to complement.
Yeah, thanks, Wenjing. I did actually type some of the responses in the chat as well. So I think they're very important and very valuable questions that we have. I think if we start from the evidence-based side of things, some of the questions related to the B lineage undetermined. And I think one of the things that's going to be very important going forward is that the surveillance within GISRIS remains strong, and that we encourage all contributors to the surveillance system to not only determine B as a type, but also to lineage determine. And then it allows us the opportunity to follow up were there to be any detections of B amigata lineage, to understand the underlying epidemiology behind those detections. Because I certainly think it's true that we've been working very hard with the few numbers of detections that we have been reported to international databases to really understand what's been going on underneath. Coming to the question of if we could include an alternate component, it's a very attractive option for the future. And superficially, you could think that it would be very straightforward to slot in, say, a couple of H3 strains. However, the underlying science that would underpin a decision to alter the components within the influenza vaccine so that we could understand what the combinations, the best combinations might be, that evidence is not there yet. And so whilst it would be a very advantageous option for the future, we need much more research to underpin our understanding of adding different components. Clearly in the future, with perhaps new vaccine formulations, perhaps new vaccine platforms indeed, we would perhaps have much more flexibility in the way that we could respond to different proportions of different types or subtypes, but we're really not in that position at the moment. So we needed last week, certainly, to disentangle the two questions. One question about the B. yamagata lack of circulation, and the other question around what we could do with a quadrivalent free slot, if you like. Moving forward, it is going to be critical that we, as we remove the B. yamagata component, we remain vigilant for B. yamagata viruses. And indeed, one of the things that we are really reaching out through the GISRIS network, particularly to our national influenza centres for, is to remind them of the importance of lineage determination and of really making sure that we understand the underlying epidemiology behind these detections. Wenqing, I think that's addressed some of the points. Shall I pass back to you and maybe you can pick up, you've got the long line list there, so that would be good.
Sure. So let me also add a little bit more also surrounding the B-YAM component. Nicola said we need to differentiate the question about what additional component could be added vis-a-vis the circulation of B-YAM. We also need to differentiate two questions. One is whether the virus is extinct vis-a-vis whether the virus should be in the vaccines. The committee considered that this component is no longer warrant. It was because the virus is no longer circulating in the population. And then another question asked how confident we are. So the influenza surveillance is conducted by this global network. And this network formally designated national influenza centers. They are more than 150. But beyond those, almost 170, 180 countries are contributing to the influenza virus surveillance globally. And this is year-round activity. So through this system, we can be very confidently to say that this virus, B-YAM, is not circulating in the population. But this is different to have a special study that this virus is extinct from the world, from the earth. This is more towards the research studies. So this is one point I want to make. The second about the question about concerns about whether the removing of one component would destroy the confidence or having some negative impact. But I think it should be the opposite. Because why we're doing so is really we are looking very closely towards what should be in the vaccines that could be most appropriate for the vaccines for use in that particular season. The reality is that the virus is not circulating in that season. So I think this is in the simplest way is that there's no need for the virus to be in the vaccines. So I think the communication, we need to do it jointly with you, that instead of the confidence or confusion, but really need to increase the confidence on the vaccines. I would like to end by saying is that the current quadrivalent vaccines with this component is safe and effective. It's only because this virus is not circulating, we are working with national regulatory agencies to remove this component into the vaccines. So let me just stop here and we can, let me first ask if Richard and Aspen would want to add to this B-YAM related questions, because a lot related to B-YAM.
I don't think I've got anything to add apart from what yourself and Nick have just discussed, Wenqing.
Okay, so with this, we can move to the zoonotic questions. Actually, there are also quite a couple. Basically, it's $1 million question. Again, Richard, H5, H7, which one will stand out as the star or as the pandemic strain next time? What do you think?
Well, I hope the answer to that, Wenqing, is none of them, but we will see. So it's very, very difficult to put sort of a real numbers on the absolute risk of these viruses. So right now we consider the human risk of these viruses, at least from a pandemic perspective, to be low, but it is certainly not zero. And again, that's one of the reasons we do these exercises, is for preparedness just in case. I would also like to sort of make a pitch now for another GIS risk program that looks at this relative risk of these different viruses in animals, and is TIPRA. So that's a tool for influenza pandemic risk assessment, which is something we haven't talked about here, but it's another tool that GIS uses, where experts score different viruses circulating in animal populations for their potential likelihood of emerging in humans, and if they do, what their impact will be. So another way of putting these viruses together and ranking which viruses, relative ranking of viruses, we should put resources into preparedness against. And when we do those exercises, often it is the H5s and H7s that, appear near the top of that list. So, in the context of where we're looking, we do look at the H5, probably and H7s very, very closely, but that there are also a number of other viruses out there that have zoonotic risk. We just unfortunately can't tell you right now what that absolute risk is. Is it 2%, 5%, 50% likely that they're going to be a pandemic virus? We just can't, unfortunately, tell you that. So that's why we've got to do what we do and do these preparedness activities just in case.
Thank you, Richard. Nicola, do you want to add anything about this question?
I think my crystal ball is about as foggy as Richard's in terms of what might emerge from the animal population. I'd say that the diversity is out there in the animal population, and we need to be ever vigilant. I think in some geographic areas, we can improve our surveillance in animal populations from a One Health standpoint, so we understand much more about the viruses that are circulating in wild and particularly domesticated animals, so that we can use them in a One Health way to use tools like Richard mentioned, the TIPRA, and to understand the risk at the human-animal interface. So I think that would be my thoughts on the zoonotic side, really to reach out to your national animal collaborators and to really work collectively together in the One Health space to understand what the viruses that are circulating in these animal populations. Thanks, Wenqing.
Thanks to you both. So as you just heard from our experts, that we at the moment, we really don't know what strain will be the next pandemic strain to cause influenza pandemic. But the signals being sending off now from the outbreaks, from the avian influenza spill over to mammals is really very alarming. So what we need to do is first strengthen surveillance, so that if a virus emerged, if a pandemic virus emerged, we would be able to pick up very quickly. And second is research and development. Hopefully, actually, I think there was a question also here. The time needed for the vaccine development would be much shorter. So that means that the time needed between the emerge of the next pandemic strain and the availability of the first dose pandemic vaccine the time would be much shorter. So this is on the research and development that we need to pursue. We still have time, actually, maybe for one or two questions. Again, let's come back to the BEYOND, because obviously people are very interested in the BEYOND component. Nicola, maybe you could explain how the BEYOND lineages are being determined in the surveillance.
So thanks, Wenqing. I think so what we have is we have a typing assay, and then we can obviously lineage determine. So there are reagents available that allow laboratories that are active in this area to be able to not only type the influenza that is circulating, but also to lineage determine. I think it's true, and I think actually Aspen might want to comment, because she's responding in the chat to the bee lineage determination challenges. Aspen, do you want to respond? Because I know you've already responded about some of the reagents and that side of things from the technical aspect, from the assay point of view, because I know you've already been active in the chat. Passing it over to you, Aspen.
Yeah, thanks. I'll just summarize what I was putting in the chat, in that in some instances, in some labs and countries, they may not have the resources to do the further lineage determination. And if there's a need for sending samples for confirmation of lineage, there may not be enough sample left to do further characterization on. So we do encourage to have samples, subtyped and lineage determined, but sometimes that's not possible for the large number of samples that are detected, viruses that are detected. Over.
Yeah, and I think I'd just follow up with that thought that it's really useful to build a partnership between the national laboratories and the collaborating centres, because we can stand by. If there's a tiny bit of residual sample left, we are more than happy to assist in supporting the national laboratories in trying to aid the further characterization. And obviously, in some cases, we might be able to find sufficient material left for us to undertake sequencing as well. So really, I think it's very important that we use all the expertise within the GISRIS network in this particular B. Yamagata situation at the moment. And I'm speaking for my other collaborating centre directors, but we stand ready to assist in any way that we can. Thanks, Wenqing.
Thank you, Nicola. I would also would like to add about the YAM issue about the risk mitigation measures. So please just don't think we just remove these. In a way, we are working very closely with manufacturers, regulatory agencies with regards to risk mitigation. In case this flu B yam comes back and cause an outbreak, what we are going to respond. But of course, there's licensed vaccines available, although the license should need to be reviewed, need to be looked into, but also technologies available. It could be monovalent, like in 2009, then monovalent pandemic vaccines were being produced rapidly of those. But of course, the regulatory process need to be looked into, and this is joint preparedness with manufacturers, with regulatory agencies, and with this all together, whether we add a component or remove a component really should strengthen the confidence in the population towards influenza vaccines, which are being looked at very closely, very seriously by a group of scientists in the world. I think I have received the signals. I think I need to stop here. So it is already 5 minutes past. Just to say that the questions not answered online will provide written answers to you if we are not anonymous, because there's certain anonymous attendees. I don't know if we will be able to manage those, but we'll follow up certainly on this. With this, I would like to thank two speakers, Nicola and Richard, as well as my colleague Aspen in this webinar session, and I hand back to Supriya.
Thank you very much, Wenqing, and a huge thanks to Dr. Nicola Lewis and Dr. Richard Webby. We now come to the end of another very, very interesting EPI-WIN webinar, and we can see from the questions and from the chat remarks that people have been very engaged as well. Thanks particularly to participants. I see that from the chat that, we have people from all over the world, colleagues, for example, from Fiji. Thank you so much for staying up. It's midnight at your time, so we really appreciate your interest. Similarly from South America and other places where it's really early in the morning. So really appreciate that. I'd like to also thank the team that's gone behind this webinar. Dr. Aspen Hammond, who's been critical, from the concept onwards. Also Dr. Christopher Chadwick, and the EPI-WIN team here, Dr. Priya Umachandran, Dr. Agnesi Pastorino, both of whom are on break but have helped, particularly Priya, who's been instrumental in this particular webinar, Jiangfeng Liu, who's not here today, but she supported us with all the tech issues, Gabriela Santeso, and also Anton Perez, they've been managing all the back work, or including the tech work around this. My thanks to the interpreters from Transperfect. Thank you for joining us every time and having great translations, interpretations. We also would like to thank Interprefy for their AI-enabled translation. Of course, the biggest thanks to Wenqing, who has been leading this and conceptualizing this, and to Dr. Richard Weber and Dr. Nicola Lewis for sparing the time and for the fantastic feedback. All the webinar has been recorded. It will be on the website, along with in different languages as well. So you can share it further with your friends and your colleagues who couldn't make it. The presentations from the presenters will also be updated. And please complete our survey if you would like a certificate of attendance for this. And please tell us in the survey how you intend to use the information you learned here. That's very useful for us to make the webinars even more useful for you. And for those who have been waiting for certificates, my apologies. That's due to constraints in our team, both tech constraints and human resource constraints. As you know, both Priya and Agnesi, who worked in these webinars, are on break, but still working. We will get the certificates out to you as soon as we can. And if you would like to know more about future webinars, please join the link on the chat. We can put you on our mailing list. Thank you very much, and hope to see you next week for the new IPC guidelines on Ebola and Marburg. See you. Bye.